The Pfizer-BioNTech vaccine trial is still in its early stages, but scientists say results so far from 44,000 volunteers show the virus can be beaten. The vaccine is based on new so-called mRNA technology and is yet to be approved by regulators. Even if it's fast-tracked, there are other challenges.
There are big manufacturing challenges. There are logistics challenges. This vaccine needs to be stored at minus 80 degrees Celsius.
That's more feasible in richer nations. But in poorer countries, rolling out a vaccination program won't be easy. At this clinic in Burkina Faso, the fridge regularly breaks down, forcing staff to throw away the medicines inside. The United Nations says health systems that serve 2/3 of the world's population don't have adequate refrigeration facilities.
So if today we had to vaccinate against the coronavirus, for example, we would need a lot more refrigerators to keep the vaccines. We don't have these fridges.
Then there's the problem of power.
The hot climate means that the cooling devices are more important and have to work harder. It's a lack of electricity. It's developing economy. So if you look in a number of these markets, you can find areas where countries where perhaps 30–40% of the health centres don't have access to electricity.
The United Nations Children's Fund spent $85 million in 2019 on refrigeration equipment, mostly solar-powered refrigerators in Africa and Asia. It's also stockpiling syringes and developing cold chain storage and transportation ahead of any vaccine approval. But in many countries, scientists say the health infrastructure simply doesn't exist to roll out any rapid coronavirus inoculation program. An added challenge is getting people to clinics or visiting them in the community and persuading them the vaccine is safe. The Pfizer-BioNTech vaccine requires 2 doses per person. Then there's the danger of vaccine nationalism, the concern that rich countries buy up all the vaccines for their own populations. Over 150 countries have signed up to a global facility called COVAX to try to ensure equitable distribution,
with the goal being to help produce 2 billion doses of various COVID vaccines that could be distributed to all of these countries around the world by the end of 2021.
Scientists say other coronavirus vaccines currently in trials also could prove effective, boosting hopes of large-scale inoculation programs. But they warn until such programs are rolled out, it's vital that governments and individuals continue to try to suppress the spread of the virus as infection rates continue to soar. Henry Ridgwell for VOA News, London.